We are about 6 months into this pandemic, and with every passing day, scientists are learning more about COVID-19. A new study prompted the Centers for Disease Control and Prevention to revise its list of high-risk categories, adding pregnant women to that list. News 8 Now's Isabella Halsizer tells us why.
The CDC has added pregnant women to the list of high-risk patients when it comes to severe illness when contracting COVID-19. The study that prompted this change found there was a higher risk of hospitalization and admission into the ICU for women who were pregnant versus those who were not.
The data didn't differentiate between whether those hospital admissions were due to COVID-19 or whether it was due to the pregnancy itself, but it is significant in itself to know that there is that greater risk for hospitalizations.
The way when this started, I already considered myself high risk because when you're pregnant, you are already immunocompromised.
Audra Keeney is expecting to deliver her 12th child next week. This pregnancy has looked a lot different than the ones before.
Consciously aware of not touching everything. I noticed when the pandemic started, I'm a toucher, and I didn't know that I touched everything before.
She and other moms have been following other CDC guidelines throughout their pregnancies.
So I try to minimize the amount of times I go out.
I wear a mask and I don't usually go places as much, just work and doctor's appointments, and that's about it.
Even with safety precautions, some moms are still weary.
Kind of scares me because I work in retail, so I come in contact with a lot of people.
And Meller says their feelings are validated.
You're growing another human within you. Your body is working overtime, and so this may be one of the reasons why we're seeing that they're more at risk for hospitalizations.
In La Crosse, Isabella Halsizer, News 8 Now.
And Meller says that once the baby is born, moms may be craving social interaction and introducing the baby to friends and family after such an emotionally taxing time. She suggests forming a quarantine of people that you can trust that will limit their social interactions with others so they can specifically spend time with the mom and baby.